Well, today is an opportunity to celebrate the 10-year anniversary of the freestanding ER in Weslaco. It is the first freestanding ER that our company had built, and it was one of the first ones in the valley. We built it 10 years here in Weslaco. It has been extremely well accepted, and for our company, it has become the model of which we now have 30 operational sites and another 10 in development. When we built this site, our goal was to try to bring healthcare closer to where people lived, as opposed to individuals having to travel to a hospital. We wanted to bring the healthcare to their communities. That's why we've done this one, as well as ones in Mission, Monte Cristo, and other areas of the valley. We also wanted to try to set a new expectation for emergency medicine care. Historically, individuals, I think, found it difficult getting to hospitals. It did not have the best reputation. And our goal was to try to make it as friendly, as customer service oriented, and as expeditious as possible, so that it would be a much better experience for the patient. In terms of the volume of patients that we see, it is not unusual to see up to 100 patients a day. We frequently average 70 to 80 patients a day. I think that alone demonstrates the level of demand there has been for these services. And in other times, such as when COVID happened, it provided really a backstop for the community. It's kept patients inpatient that we held here. And at times we held up to 65 patients between the 6 sites in the valley during some of the surges during COVID. But it was a safety net for the hospitals. There is still opportunity for additional sites. We now have 7 sites open. The 7th one was recently opened in FAR. And there's opportunity to develop several additional sites in the valley and to, again, bring our quality of care for South Texas Health System to the surrounding communities. I think there is an extreme focus on our part in terms of the customer service experience, as well as trying to provide as expeditious care as we can. Our focus is on our performance improvement metrics and on our online star ratings. We're thankful for the reception that we have received from the communities in the valley, whether it is Monte Cristo area, or the FAR area, or even something central like on McCall. Our sites have been extremely well accepted, and I think the community has benefited because they do not have to go to a hospital for care. They can get the same care they would get at a hospital, but get it closer to their home.